So the World Health Organization, or WHO, in 2014 recognized that non-communicable diseases killed nearly half, or more than half, of Cambodian citizens at 52%, whereas in 2011, so just 3 years prior, it was about 46%. So it increased, and we know that a lot of what is seen in the healthcare industry is curative medicine, not necessarily preventative care, which was the purpose of this project. You know, we wanted to assess their need for integration and also do some workforce development type of work so that we could train physicians and nurses and community health workers on, you know, various modalities, brief interventions that they could use that could help their patients not take accountability for themselves, but also, you know, prevent some of the NCDs and the high incidence of that we're seeing. You know, things like smoking are very high. Substance use like alcohol. You know, there's lower physical health, you know, not much exercise. Although I have to say, one night while I was down on the riverside in Phnom Penh, I did see a very cool group of people exercising, and I'm talking about from age, I think, like 3 up to a 90-year-old woman out there exercising. So it's not impossible, but teaching the physicians and teaching the Cambodian nationals about how that can benefit them and to utilize that and do more of that is going to be critical to really seeing their healthcare industry thrive, which is the ultimate goal. That's what I would love to see. So during the Khmer Rouge, while Pol Pot was the ruler, you know, they really targeted not only, you know, national regular living people, but they also targeted those that were highly educated because they felt like they had the most influence and were doing the most damage to the country as far as the type of society they wanted. So they killed off so many highly educated people. We're talking about judges and doctors and dentists and lawyers. And so when the Khmer Rouge, you know, was overruled or overturned in 1979, they only had about 45 medical doctors left within the country, and 20 of them ended up leaving. And then they had 26 pharmacists, they had like 28 dentists, and I think they had about 728 to 730 medical students. That was in 1979. That's really not that long ago when you think about it. And so when you think, you know, how far they've come and how much they've persevered through, it's actually quite amazing to me that they've made the progress that they have. Sure, the hospitals aren't up to Western standards, at least the provincial hospitals that I was in, which included Siem Reap Provincial Hospital, not Phnom Penh, the Khmer Soviet Friendship Hospital, and then the Kampong Cham Provincial Hospital. But the staff was so friendly and willing to collaborate with me and help me gather the data that I needed. And I just am so grateful that they were willing to open up their hospital and their patients to share that with us so that we can learn from them and that they can learn from us. This program has benefited me in so many ways when I'm thinking about it. I had an amazing experience. You know, who gets to travel out the country for as long as I did solo and willingly goes for it? I figured, why not take this chance if it's being presented to me and it's for an amazing cause? You know, we want to build these global relationships, especially in the health world, because it's so important to have global health, because health affects everyone. It's not just a US or a Western issue, it's all around the globe. And so why not take the opportunity to share my knowledge and in turn gain knowledge from those who are in another country who may be doing things, you know, I don't want to say right, because I don't think our way is wrong, but who may be doing things a little bit differently than us, and we can learn from them just like they can learn from us. I think it's an invaluable experience to share that knowledge. But not only that, I also, you know, not just professionally, but personally, I've grown. I've learned that I can do anything I set my mind to. I've gained confidence and know that I can do it. This project just meant so much to me. This experience meant so much to me. And I wouldn't change anything that I experienced, none of the struggles that I had, obviously none of the highs that I had. I am eternally grateful to ASU, to the GDR program, to USAID, and, you know, to the College of Health Solutions, my DBH program.